Hi there, I'm Dr. Augustine from the Fast Pain Relief Center here on Grand Island, New York. I'm really glad you found our website today on autoimmune conditions. And simply there's a lot of different autoimmune conditions, and what research is really pointing to now is that autoimmune conditions are really on a rise. And that can be anywhere from Crohn's disease to MS to scleroderma. There's even some forms of Parkinson's that are considered autoimmune as well. And another cause of autoimmune can even be thyroid conditions, specifically Hashimoto's thyroid. So those are just a few, but there's many different types of autoimmune conditions. And in essence, many of the patients that I see with autoimmune conditions have a sense of frustration because they've usually been to lots of doctors and they've been on a lot of medications, and these are the people that typically come to my office with a bag full of supplements that they've been on. Maybe things that they've even heard from Dr. Oz, they've heard from Oprah, and they think it's good for them to take, and it may be, but they're on just a bag full of them. And those are some kind of clues. So if that's you, there's a good chance that you have an autoimmune condition. Another clue can be also a genetic factor as well. If you have a family member that has the same condition as you, or even another form of an autoimmune condition, there is a good chance, again, of having that problem. And here's what we've been finding. There's some new research that's been out on how to treat the autoimmune condition. Whether, again, that's MS, whether it's Crohn's disease, Hashimoto's, scleroderma, lupus, with all those different conditions, I'm sure you've been through a litany of tests. You've been through the diagnostic MRIs, the CAT scans, the blood work, ultrasounds, whatever it might be, but maybe they still, your doctors just continue to put you on more medications. If you're fed up with that, if you've been on medications or injections and you haven't been getting any better and it's just not the thing for you, then listen closely to what I'm about to tell you, because it can change your life, like I've seen it for many others. Dealing with an autoimmune condition, what you really have to do is look at the immune system and see how it's functioning. And what I mean by that, there's some things within the immune system that you can measure via blood work, like cytokines. And cytokines are basically proteins and within the immune system. Okay, and the cytokines can be imbalanced. And I don't know if you've ever heard any of this before. I'm kind of giving a really, really broad overview of this. Now, if your cytokines are imbalanced, there's two major ones that I look at. Number one is cytokines called Th1, and also cytokines called Th2. It stands for T helper cells 1, T helper cell 2. And essentially with that, if you have a dysregulation with those, think of this: if Th1 is up here and Th2 is down here, you're going to have a problem with your immune system, because those Th1 system, if you want to think of it, they kind of put post-it notes on cells that are bad and need to get killed. And we all have that going on in our body. Now Th2 system, if you want to think of it like this, does the hand-to-hand combat with these cells and actually does the killing of them. Now the problem exists, again, when you have a dysregulation with that, or you have something called an active antigen that can be causing a further problem. And that can be, a yeast problem, parasites, bacteria, it can be heavy metals, it can be, lots of different things. And those are some of the things that I look at to see if they were managed properly. And I can tell you with a shadow of a doubt that probably only about 1% of the patients that I see have even had any of those testing done. So the main key, the concept that I want you to get there, is you have to look at and monitor the immune system. And with any treatment that you do, that's the other thing you have to look at, is how is the immune system doing? Is it being regulated? Is it being stimulated adversely, causing these symptoms to get worse and worse? And some of this may even be caused by food that you're eating. How do you know? I don't know, but you got to do some testing. I can tell you one of the biggest factors that I often see can be gluten sensitivity, soy, eggs, yeast, milk. It can be all kinds of different things. But you have to test for it. So if you're frustrated, you've been to lots of specialists, then this may be an opportunity for you to possibly get some help. And whether you're listening to us on a local basis or around Buffalo, Western New York area, or if you're listening to this on the internet from across the country, there still may be hope for you. We consult with a lot of different patients from different areas. You do not have to be local. So if this is something that interests you and you'd like to get more information, one of the things that I offer are 2 free visits. And here's what happens with those. The first visit, you basically come in, you're going to get some paperwork sent to you, which has to be filled out and sent here before we either talk or we physically see you to go over. And this is it's pretty extensive, paperwork. And it really allows me to kind of get an insight of what's going on with you and what types of things that you've had in the past and all that good stuff. But essentially that's the first visit. The second visit allows us to see if I can even help you, and I'll let you know if I would accept your case or not. If it's something outside of my scope, perhaps it's been too far advanced, you waited too long to get help, to get treatment, then I will simply refer you to another doctor or specialist, or you can keep doing what you're doing, and usually it's medications or possible a surgical procedure at some point in time. But those are for the people that wait too long. And I can tell you again from experience, one of the biggest things that I get told by patients that do come in is, I wish I would have done this sooner. How come my doctor didn't tell me about this? Well, so don't waste any time. If you're serious about this and you really truly want to get better, then this is the right place for you. I've been dealing with chronic pain patients for over 12 years now, treating chronic neurological, endocrine, and immune disorders, and in a natural way. So again, my name is Dr. Kevin Augustine. If this is something that does interest you, please call us. And 716-773-4707. Or you can just fill out this form on the bottom of the page, and that will simply get our office the right information to give you a call and set up an appointment, whether it's over the phone or in the office, and see if you can possibly get help from your autoimmune condition. Thank you, and if you have any questions, feel free to call us. I'd be glad to help you. God bless.